My name is Jolanta Emmons, and I came to U.S. in 1982 as a child who immigrated from Poland, basically not out of my free will, but by my mother. And my father was left in Poland. It was traumatic. And Poland at that time was under martial law, and there was traumatic things happening in Poland at the time. I didn't speak a word of English when I came. But I am a mother of 4 wonderful, beautiful children. I was hospitalized in 1991 due to a traumatic experience, which happened in my city of New Britain, Connecticut. And all my hospitalizations and experiences which I had with hospitals, psychiatric hospitals, were in Connecticut. I was abused by hospital doctor, who was Dr. Gerson Sternstein at that time. I was forcefully restrained against my will the day that I was supposed to be released.
Just to interrupt, Dr. Sternstein has been in the news.
Yes, he lost his license.
He lost his license for over-drugging and
yes,
irresponsibly treating
right.
patients.
I was so horribly, inhumanely treated and dehumanized. I had to learn everything from the beginning. I was so drugged that I didn't even know if I was dead or alive. I didn't know what was going on with me because I never used or abused drugs in my life. Mm-hmm. So I never knew the feeling of being drugged. Mm-hmm. And I was drugged to the point that I was stiff, to the point that I could not feed, bathe myself, eat. I lost a lot of weight. My mom would come and feed me. I was 90 or under 90 pounds. Mm. I was as I was walking as I was walking to be discharged. I was walking towards my sister, and I was pushed to the room, and I thought I was going home. Mm-hmm. I was pushed into the room and thrown on the gurney and tied down my ankles and my wrist and shoved down medication and needles, and it's a horrible experience because I was kicking, screaming. Of course I was reacting to the abuse that I was enduring. I was me. Mm-hmm. There was many of them doing this to me. And if I would clench my teeth not to take the medicine, and they would pry open it, then they would give me liquid medication, mm-hmm. and that's how they overdrugged me. And when I woke up, I really didn't know who I was. Mm-hmm. Then I had a miscarriage in late 90s or 2000, and I ended up in a hospital again. And I remember I was singing, and instead of the nurse telling me to stop singing, she called the security, and they came and they restrained me again. Mm-hmm. That was in Mount Sinai Hospital. Mm-hmm. They put me on the bed, tied me up again, and one security guard was like sitting in the feet, and I felt like I was raped on the bed.
I'd sorry to interrupt. And why did they do that again? Can you just clarify for Ellen why they?
Because I was singing.
You were singing.
Instead of trying to stop me from singing or do another.
Well, singing also tends not to be a violent act. It's usually
right.
acceptable. Yeah.
But see, and when you get restrained, when these things happen to you, you don't know what is right, what is wrong. Mm-hmm. So everything that you do in life, it's under a microscope. Mm-hmm. Mm-hmm. Am I going to get put away because I did this? Am I going to be put away because I did that? I had an appointment. I was seeing Kimberly Saucier, who is an APRN and her therapist. And I came into the office on the 19th of December complaining of chest pain, and I thought I was having a heart attack because it was so severe. Her, Glenn, her office manager, came and diagnosed me basically with her, gave me water, mm-hmm. and they said, we'll call 911 to have you checked if you're having a heart attack or whatever. But they wanted me to go to the hospital because I didn't maybe act right or something. I don't know. Mm-hmm. But I went with chest pain. I ended up on psychiatric ward against my will. I wasn't homicidal. I wasn't suicidal. Mm-hmm.
What happened between the time you arrived at the hospital and when you were admitted to the psych ward?
There was two people in the ambulance. There was a female and male. And the female was very nice and gentle. The male, for some reason, from the beginning, I thought, he's not right. And he asked me if I was suicidal. And I said no, but I said I was years ago. And stupid me, in 1991, and this was 30 almost years ago, that I admitted to something that I was years ago. Mm-hmm. And that's how...
That was it?
Mm-hmm.
That was when they admitted you?
Yes.
Right, when you arrived, because you said you were suicidal years before. Mm-hmm. That's what you remember, at least.
Yes. I came out, I went to a legislative office in Hartford with my friend, and we spoke to, she made an appointment with Peter Tercyak, mm-hmm. and he basically told me, and I was very unhappy, and I couldn't understand. Here's the figure in the legislative office telling me that I should take my medicine or people will put me away if I don't and find out that I have this issue. Mm-hmm. That was very disturbing to me and my friend, who said, and thank God I was with her, because she, as a commissioner of one of the committees in my city, couldn't believe. And she said, he just lost my vote. I can't believe he said that to you. Mm-hmm. Actually, my boyfriend called 911 because I was playing his radio too loud, and he was afraid that I would break his amplifier. And that's how they took me to ER. Because
can you just... so the police came after your boyfriend called 911, and why did they take you to the hospital?
I don't even know. I was taken to, I don't know if it's Johnson Memorial in ER, and I was placed in a room with a person, heroin addict, who was vomiting, who they were drawing blood and couldn't draw blood because they said that she used all her veins. I was fragile as it was to be subjected to that. I could not go to the bathroom by myself. I was escorted. I couldn't take a shower. I couldn't call anyone to help me, or did I? I don't think I even knew the numbers, because now with the cell phones, it was in 2014, and I was there for 3 days. How can you put a person so fragile, with emotionally distraught, 3 days in an atmosphere like that? I finally, by the third day, I threw myself, and I knew that this was going to happen. I just threw myself on the floor, and that's when they transferred me to Natchaug Hospital. And these things that they do in the hospitals are provoking people to desperate measures. It's sick. It's disturbing.
When you say that, desperate measures, because you didn't know why you were there. Right,
I didn't know why I was there. I couldn't move around. I couldn't take a shower. This is what? Mm-hmm. Inhumane. I took care of patients for 20 years. I worked in America for 30 years, over 30 years. I don't have a criminal record. I don't steal. I don't do any of that stuff. And for me, everyone loves me when I take care of them. Even my friend who's an administrator of nursing home, she says, I don't know where her empathy comes from. She has tremendous amount of empathy for people, but I think my empathy is from what I've been through. Mm-hmm. But that's not it. Also, the doctors that they do have come for a period of time, 2 weeks. My doctor didn't even know me. how can he prescribe me medication? I was forced medicated by Haldo that I was told them that I was allergic to. I was crying, giving my arm to give me a shot. I don't want this. I don't want this. I'm allergic to it. And they said, if you don't take it, you're going to go to the room. And it was the restraint room right across the nurse's station. Also, I was forced medicated. I was threatened to be locked up in the I call it padded room because it's padded. It has pads all over the walls, you know, and it's tiny. It terrified me to go there.
I've been in one. They put me in one for laughing once.
I think I would die if I went to that room. Honestly,
it's essentially it's solitary confinement.
Yeah.
But again, you were never charged with a crime.
No.
And do you remember any specific incident? Is there anything written down in your records that you remember that they said you did?
I don't know because I'm afraid to open it.
Mm-hmm.
You know, I went to get my records in Natchaug. It was last year. I spoke with this lady, Marie. She's super, super nice, sweet, but she doesn't do anything. It's almost like she was afraid of me. But I took her kindness that she was gonna help me, you know, like I'm gonna help you, you know, because she seemed so nice. And while I was there for my medical records, I think I had to go with somebody because I was afraid that I was gonna be locked up. The anxiety and did you ever get that?
Yeah, I was handcuffed by a psychiatrist. He had police come in. And I wanted to go back and ask him why he decided to have the police come and handcuff me, because he never actually told me, but I never did, because I was afraid if I went and asked him, confronted him, so to speak, he would just have me handcuffed again. So I do know what you're talking about.
It's extreme, like you have no rights. And I also wanted to say that my background is in healthcare. I worked as a nurse's aide for 20 years. I would never even think about treating my Alzheimer's patient the way I was treated. At no time at all. And that's when I started knowing that what was done to me was not right, because I was taught, I was going to in-service and things like that, learning the right way to approach and the laws and stuff like that.